Hey guys, today I am gonna tell you about mesothelioma symptoms, causes, diagnosis, and treatment. This chart may be useful for you guys to get an idea. Before we proceed, don't forget to like, share and subscribe us and click on bell icon so you will never miss any updates from our channel positive side. Let's move on. Malignant mesothelioma is a type of cancer that occurs in the thin layer of tissue that covers the majority of your internal organs, mesothelium. Mesothelioma is an aggressive and deadly form of cancer. Mesothelioma treatments are available, but for many people with mesothelioma, a cure is not possible. Doctors divide mesothelioma into different types based on what part of the mesothelium is affected. Mesothelioma most often affects the tissue that surrounds the lungs, pleura. This type is called pleural mesothelioma. Other, rarer types of mesothelioma affect tissue in the abdomen, peritoneal mesothelioma, around the heart and around the testicles. Mesothelioma doesn't include a form of non-cancerous, benign, tumor that occurs in the chest and is sometimes called benign mesothelioma or solitary fibrous tumor. Here are some of the signs and symptoms of mesothelioma vary depending on where the cancer occurs. Pleural mesothelioma, which affects the tissue that surrounds the lungs, causes signs and symptoms that may include chest pain under the rib cage, painful coughing, shortness of breath, unusual lumps of tissue under the skin on your chest, unexplained weight loss. Peritoneal mesothelioma, which occurs in tissue in the abdomen, causes signs and symptoms that may include abdominal pain, abdominal swelling, lumps of tissue in the abdomen, unexplained weight loss. Other forms of mesothelioma. Signs and symptoms of other types of mesothelioma are unclear, since these forms of the disease are very rare. Pericardial mesothelioma, which affects tissue that surrounds the heart, can cause signs and symptoms such as breathing difficulty and chest pains. Mesothelioma of tunica vaginalis, which affects tissue surrounding the testicles, may be first detected as swelling or a mass on a testicle. The second thing is when to see a doctor. See your doctor if you have signs and symptoms that may indicate mesothelioma. Signs and symptoms of mesothelioma aren't specific to this disease and, due to the rarity of mesothelioma, are more likely to be related to other conditions. If any persistent signs and symptoms seem unusual or bothersome, ask your doctor to evaluate them. Tell your doctor if you've been exposed to asbestos. Mesothelioma causes included. In general, cancer begins when a series of genetic mutations occur within a cell, causing the cell to grow and multiply out of control. It isn't clear what causes the initial genetic mutations that lead to mesothelioma, though researchers have identified factors that may increase the risk. It's likely that cancers form because of an interaction between many factors, such as inherited conditions, your environment, your health conditions and your lifestyle choices. Mesothelioma risk factors. Asbestos exposure, the primary risk factor for mesothelioma. Asbestos is a mineral that's found naturally in the environment. Asbestos fibers are strong and resistant to heat, making them useful in a wide variety of applications, such as in insulation, brakes, shingles, flooring and many other products. When asbestos is broken up, such as during the mining process or when removing asbestos insulation, dust may be created. If the dust is inhaled or swallowed, the asbestos fibers will settle in the lungs or in the stomach, where they can cause irritation that may lead to mesothelioma. Exactly how this happens isn't understood. It can take 20 to 40 years or more for mesothelioma to develop after asbestos exposure. Most people with years of asbestos exposure never develop mesothelioma. And yet, others with very brief exposure develop the disease. This indicates that other factors may be involved in determining whether someone gets mesothelioma or doesn't. For instance, you could inherit a predisposition to cancer, or some other condition could increase your risk. Factors that may increase the risk of mesothelioma include personal history of asbestos exposure. If you've been directly exposed to asbestos fibers at work or at home, your risk of mesothelioma is greatly increased. Living with someone who works with asbestos. People who are exposed to asbestos may carry the fibers home on their skin and clothing. Exposure to these stray fibers over many years can put others in the home at risk of mesothelioma. People who work with high levels of asbestos can reduce the risk of bringing home asbestos fibers by showering and changing clothes before leaving work. A family history of mesothelioma. If your parent, sibling, or child has mesothelioma, you may have an increased risk of this disease. Diagnosis for mesothelioma. If you have signs and symptoms that might indicate mesothelioma, your doctor will conduct a physical exam to check for any lumps or other unusual signs. Based on the findings, you may undergo further testing to determine whether mesothelioma or another disease is causing your signs and symptoms. Your doctor may order imaging scans, such as a chest X-ray and a computerized tomography (CT) scan of your chest or abdomen, to look for abnormalities. Biopsy, a procedure to remove a small portion of tissue for laboratory examination, is the only way to determine whether you have mesothelioma. Depending on what area of your body is affected, your doctor selects the right biopsy procedure for you. Options include fine needle aspiration. The doctor removes fluid or a piece of tissue with a small needle inserted into your chest or abdomen. Thoracoscopy allows the surgeon to see inside your chest. In this procedure, the surgeon makes one or more small incisions between your ribs. A tube with a tiny video camera is then inserted into your chest cavity, a procedure sometimes called video-assisted thoracoscopic surgery, VATS. Special surgical tools allow your surgeon to cut away small pieces of tissue for testing. Laparoscopy allows the surgeon to see inside your abdomen. Using one or more small incisions into your abdomen, the surgeon inserts a tiny camera and special surgical tools to obtain a small piece of tissue for examination. Thoracotomy is surgery to open your chest between the ribs to allow a surgeon to check for signs of disease. A sample of tissue may be removed for testing. Laparotomy is surgery to open your abdomen to allow a surgeon to check for signs of disease. A sample of tissue may be removed for testing. The tissue sample is analyzed under a microscope to see whether the abnormal tissue is mesothelioma and what types of cells are involved. The type of mesothelioma you have determines your treatment plan. Determining the extent of the cancer. Once your mesothelioma is confirmed, your doctor may recommend additional tests to understand whether your cancer has spread to your lymph nodes or to other areas of your body. Tests may include CT scans of the chest and abdomen, magnetic resonance imaging, MRI, positron emission tomography, PET. Your doctor determines which tests are appropriate for you. Not every person needs every test. Your doctor uses the information from these tests to assign your cancer a stage. The stages of pleural mesothelioma are indicated using Roman numerals ranging from I to 4. A lower numeral means the cancer is more likely to be localized to the area around the lungs, and the highest numeral means the cancer has spread to other areas of the body. The cancer staging system continues to evolve and is becoming more complex as doctors improve cancer diagnosis and treatment. Your doctor uses your cancer stage to select the treatments that are right for you. Formal stages aren't available for other types of mesothelioma because these types are rare and aren't well studied. Treatment doctors suggest What treatment you undergo for mesothelioma depends on your health and certain aspects of your cancer, such as its stage and location. Unfortunately, mesothelioma often is an aggressive disease, and for most people a cure isn't possible. Mesothelioma is usually diagnosed at an advanced stage when it isn't possible to remove the cancer through an operation. Instead, your doctor may work to control your cancer to make you more comfortable. Discuss treatment goals with your doctor. Some people want to do everything they can to treat their cancer, even if that means enduring side effects for a small chance of an improvement. Others prefer treatments that make them comfortable so that they can live their remaining time as symptom-free as possible. 1. Surgery. Surgeons work to remove mesothelioma when it's diagnosed at an early stage. In some cases this may cure the cancer. Sometimes it isn't possible to remove all of the cancer. In those cases, surgery may help to reduce the signs and symptoms caused by mesothelioma spreading in your body. Surgical options may include surgery to decrease fluid buildup. Pleural mesothelioma may cause fluid to build up in your chest, causing difficulty breathing. Surgeons insert a tube or catheter into your chest to drain the fluid. Doctors may also inject medicine into your chest to prevent fluid from returning, pleurodesis. Surgery to remove the tissue around the lungs or abdomen. Surgeons may remove the tissue lining the ribs and the lungs, pleurectomy, or the tissue lining the abdominal cavity, peritonectomy. This procedure won't cure mesothelioma, but may relieve signs and symptoms. Surgery to remove as much of the cancer as possible, debulking. If all of the cancer can't be removed, surgeons may attempt to remove as much as possible. Debulking allows doctors to more accurately direct radiation treatments to relieve pain and fluid buildup caused by mesothelioma. Surgery to remove a lung and the surrounding tissue. Removing the affected lung and the tissue that surrounds it may relieve signs and symptoms of pleural mesothelioma. If you'll be receiving radiation therapy to the chest after surgery, this procedure also allows doctors to use higher doses, since they won't need to worry about protecting your lung from damaging radiation. Second option is chemotherapy. Chemotherapy uses chemicals to kill cancer cells. Systemic chemotherapy travels throughout the body and may shrink or slow the growth of a mesothelioma that can't be removed using surgery. Chemotherapy may also be used before surgery, neoadjuvant chemotherapy, to make an operation easier, or after surgery, adjuvant chemotherapy, to reduce the chance that cancer will return. Chemotherapy drugs may also be heated and administered directly into the abdominal cavity, intraperitoneal chemotherapy, in the case of peritoneal mesothelioma. Using this strategy, chemotherapy drugs can reach the mesothelioma directly without injuring healthy cells in other parts of the body. This allows doctors to administer higher doses of chemotherapy drugs. Third option is radiation therapy. Focuses high-energy beams from sources such as X-rays and protons to a specific spot or spots on your body. Radiation may be used after surgery to kill any remaining cancer cells. It may also help reduce signs and symptoms of advanced cancer in situations where surgery isn't an option. Latest research is clinical trials are currently investigating a number of new approaches to mesothelioma treatment, including targeted therapy, which involves using drugs that attack specific abnormalities within cancer cells. Biological therapy, which uses your body's immune system to fight cancer. Gene therapy, which involves altering the genes inside the cancer cells in order to stop disease. Toxic chemo and radiation therapies aren't the only options on the table for mesothelioma sufferers. Dietary changes can make a difference. Klaus is only one example of mesothelioma survivors who have continued to live because they followed the right diet for them. A diet rich in antioxidants has been scientifically shown to actively fight against a range of cancers, including mesothelioma. The same goes for vitamin C, 4, therapy. Nutrition is important, and making simple changes to your lifestyle can negate the need for complex and toxic therapies. You can be a victim of cancer, or a survivor of cancer. It's a mindset. No matter what the statistics say, there is always a way. Cancer is a journey, but you walk the road alone. There are many places to stop along the way and get nourishment, you just have to be willing to take it. Subscribe us for more updates. God bless you.